Hello everyone, welcome to our today's video. I am Dr. Sujan here and I will be discussing about an interesting case that I scanned yesterday. So first let me tell the details of the patient. Patient was about 25 years old and she had her last menstrual period about 2 months back. So it was about amenorrhea for 2 months and she complained about lower abdominal pain and vomiting. So in first trimester pregnancy, we know that lower abdominal pain and vomiting is very common, but the patient was repeatedly telling that the pain was very intense and severe. Sometimes it is so severe that she cannot even do anything. Even sometimes for pain she vomits. So I was suspecting that there could be something wrong in this patient. So I scanned and here is the real-time picture you can see. So if I briefly describe this real-time picture, you can see that this is the uterus, you can see, and in uterus there is a gestational sac, and in the gestational sac there was a fetal pole, and there was also present cardiac activity. Heartbeat was about 154 heartbeat per minute. So it is not a problem that it is intrauterine pregnancy, it is not a problem. But after several seconds I discovered that there is something, there is another cystic structure in about the left adnexal region. So this confused me and I repeatedly scanned, and you can see this is the actual picture of that complex cyst that I scanned. You can see there is a thick-walled cyst, and there is some solid component within the cyst. So this is very suspecting for an ectopic pregnancy. So I put color Doppler there, and you can see there is a very typical ring of fire sign that we get in ectopic pregnancy. So if I summarize, the patient had an early intrauterine pregnancy and the patient also had an adnexal ectopic. So it is bilaterally present that the patient is intrauterine pregnant and also adnexal pregnant. This is very rare case and very dangerous case for the patient. If you miss this diagnosis and if the adnexal ectopic is ruptured, that can be life-threatening for the patient. So don't be excited to get an intrauterine pregnancy. Rather try to search both adnexa for any other cystic lesion, and if you can locate any suspecting lesion that can be ectopic, put color Doppler and exclude if it is an ectopic pregnancy or any other corpus luteal cyst, normal cyst. So it is our learning that you must check the adnexa very carefully. Check the adnexa if there is any other cystic lesion there. Okay, so that was the case that I wanted to share with you all. Thank you very much for watching, and in my next video I will try to explain about this case. Briefly I will explain this case and I will tell the actual diagnosis of this case. And one more note that you can learn, that to confirm this diagnosis, this is not confirmatory, but to confirm the diagnosis you can advise beta ECG, and you can also perform TVS for further evaluation and confirmation of this patient. So that's all for today, and thank you all, and I wish you all a very happy and healthy day. Thank you very much.